MRCP, MRCM, MRCS and MRCOG exams have been very popular postgraduate exams in the subcontinents including India, Pakistan, Bangladesh and many of the Middle Eastern countries. The exams have also provided an entry-level assessment exam for further specialist training or advanced training in the UK. Now, two of the most frequent questions that often get asked about the UK membership exams are if any of these exams provide an exemption from AMC, that is Australian Medical Council licensing exams, and secondly, if the membership exams can be useful to gain an entry into the specialist training here in Australia. These questions have become even more relevant when the Royal Australasian College of General Practitioners recently announced recognition of MRCGP International in March 2023, allowing experienced general practitioners to come work here in Australia independently. Also, when I arrived here in Australia back in 2006, my MRCS exam from the UK actually helped me to get an exemption from one of the primary subjects, that is anatomy. And I think also to some extent that complete MRCS examination may have even helped me to gain a very important job here in one of the largest tertiary hospitals in Sydney. So it's not unfair to assume that UK membership exams have some validity, although not officially, but yes, unofficially they have got still some relevance. So I'm going to break this conversation down into why are the UK membership exams important, membership exams and exemption from AMC if it's possible. Number 3, getting into advanced or specialist training here in Australia based on the membership exams, does it help or not? Number 4, membership exams and jobs here in Australia and the future of UK membership exams here in Australia. And finally, I'll give you my recommendations based on all of these factors. Now, UK membership exams. The reason for extreme popularity of UK membership exams all over the world was primarily the fact that the doctor can complete the membership exams with or without any formal medical training in their own country. This is especially true in India, Pakistan and even Bangladesh and many of the Middle Eastern countries where they either did not have their full specialty colleges or their colleges were not geared enough to take enough trainees. Now, we know for a fact that postgraduate medical training are limited and fiercely competitive in all of these third world countries. Doctors in India need to take NEET PG exam and then based on the scores get ranked to choose the specialty and location of the training. In Pakistan, even though there is no current ranking system, but there are hardly enough training positions in both public and private hospitals to meet the need of fresh postgraduate doctors. To bridge this gap, there are Royal College of the UK and Ireland, not one but 4 of them, England, Scotland, Glasgow and in Ireland, which have been around for centuries and working a very efficient industry of providing an entry-level membership and a certain specialty exit-level fellowship exam. Now, these exams have got validity in a wide range acceptance. The fellowship exams have long history of acceptance throughout the world, including Australia as specialist qualification. So as a result, it is perfect for doctors who felt that if they do not gain entry into a training position in India, Pakistan, they might as well just join any hospital and work towards the UK membership exam. And when the GMC allowed registration based on the full completion of membership exam, it was even more favorable to get into a self-constructed training pathway. I mean, realistically, what is there not to like? You are getting a better lifestyle in the UK, better salary and worldwide recognition compared to your own native postgraduate qualifications. Now, exemption from AMC Competitive Authority Pathway. Now, Competitive Authority Pathway is very clear in its delivery of exemption for AMC exam. It allows the doctors to get provisionally registered here in Australia for 2 main reasons. Number 1, if they have passed PLAB, and number 2, if they've worked in the UK for 12 months and they have a current job offer here in Australia. In this competent authority pathway, there is no mention for any of the UK membership exam at the time of making this video. So currently, no AMC exemption by doing membership exams either partially, fully, even with the UK job experience. Number 2, getting into the specialist training based on the membership exams. Now, I know that membership exams are still the token required to get an entry into the advanced or specialist training in the UK, but in Australia, a specialist pathway for surgical specialties or medical specialties are based on a scoring system. There are scores for relevant clinical experience, courses, research, poster presentation, and interview performance. There are no scores for UK membership exams for medical or surgical specialties, not recognized to gain entry into the training program. Membership exams and jobs. I do think membership exams help get you shortlisted for important jobs here in major tertiary centers in Australia. These jobs are mostly SRMO and non-accredited registrar jobs in emergency, ICU, surgery, medicine. However, the important thing to note is that once you have a good hospital experience in your CV in Australia, then the further process of getting into specialist training becomes an easier one, at least once you've fulfilled the rest of the essential criteria. The future. One of the most important things about the medical recruitment is demand and supply. Currently in Australia, there is a deficiency of GP in regional, rural and even some metropolitan areas, and hence MRCGP International is now recognized. However, there is no deficiency of surgical, medical, critical care, ED, ICU, specialty trainee aspirant doctors. Hence, I don't personally see MRCS, MRCP or MRCEM getting any meaningful recognition in the near future. In Australia, at least for the specialist training gaining entry or getting an exemption for the AMC licensing exams. So my recommendations are basically two-tiered. My first recommendation will be for the doctors who have passed any UK membership exams and completion in the UK and have got relevant clinical experience in the UK. I would seriously ask you to consider doing AMC Part 1. This will truly unlock your full potential and you will be able to get directly jobs in ED, medicine, psychiatry and rest of the other specialties, even though they might be non-training job, but they will get you that essential reference and very important point in the CV to enable you to get a further training positions towards your eventual goal of becoming a specialist here in Australia. Now, AMC Part 1 is a very simple exam with a well over 60% pass rate and plenty of available dates throughout the world. So this is something which should not be a very difficult thing for you to do. My second recommendation is actually a suggestion to AMC APRA and especially Australasian College of Emergency Medicine to consider accrediting MRCEM exam along 12-month of ED experience in the NHS. Reason being, firstly, the MRCEM exam has a very broad clinical base, including clinical specialties like medicine, surgery, ONG, psychiatry, pediatrics, and critical care. So it is very similar to AMC or PLAB exam. In fact, it might be even more challenging and difficult. Also, the OSCE component or the VIVA component or the practical component of the MRCM has strong component of communication skills, the teamwork, clinical prioritization, same as AMC2. Lastly, if the doctor has worked in the NHS for 12 months after MRCE exam in fields like emergency medicine, ICU, anesthesia, medicine, or just even in emergency medicine alone, then his clinical experience, given the volume of the patient and core knowledge, which is highly relevant experience in regional, rural hospital in Australia where the senior supervision is often very lacking. So please do give these doctors a chance to come and work here independently in a senior role. Now, if you like this video, please subscribe to our channel, take a good care of yourselves and each other, and I'll catch you in the next video. Goodbye.